Today I'm going to be performing an oral mech exam, and afterwards I will follow with a food trials exam. So for the oral mechanism exam, I'm going to be looking at his facial and neck structures to look for any abnormalities, scarring, anything that could interfere with a swallow. I will also be looking at his oral and laryngeal function to make sure that he's able to swallow safely. So to start out, looking at him, I'm able to see that he has no oral secretions coming out. His face is symmetrical. I can see that there's no scarring on the lips or the face. And just going to look inside your mouth as well. At just the structures. Using the tongue depressor just to see inside a little better. See the fascial pillars, the lateral sulci, the tongue, see, all look good. So I've noticed also as he sits here that he's breathing quietly. And can you hold your breath for me for at least 6 seconds?
Six.
Awesome, thank you. Okay, so now we're going to look at the function. And first, we're going to look at the jaws function. So can you open and close your mouth? Perfect. I'm going to have you do the same thing but with some resistance to check the strength. And so can you open your mouth? Awesome. And keep your mouth open and now try and close it. Great. Can you move your jaw from side to side? Thank you. And now protrude your jaw forward as if you have an underbite. Awesome. You can see his jaw has full range of motion. Now I need you to purse your lips. Great. And now I'm going to put the tongue depressor in your mouth, and I want you to seal your lips around the tongue depressor. So as I pull out, I'm going to be testing just to see if you can resist it a little bit with just your lips and not your teeth. Perfect. Okay. And I can see that he has smiled and it looked symmetrical as he did that. Can you puff air inside your cheeks and then hold it? Great. Now looking at the tongue, can you stick out your tongue as far as you can? And then retract it back as if you're going to say the G sound.
G.
Like this. Good.
Good.
Great. Can you move your tongue from side to side? Yeah. And then can you use your tongue to clear off peanut butter as if you had peanut butter on your roof of your mouth? Good. Can you raise your tongue up and down by touching the roof of your mouth and then the bottom of your mouth? Thank you. Now I want you to use the tongue and to push on inside of your cheeks, back and forth. Great. Now we're going to be looking at more function, and so to do this I want to have you say a couple sounds for me, and I want you to repeat them for about 10 seconds. So the first sound that I want you to do is the pa-pa-pa-pa-pa. So say pa-pa-pa for about 10 seconds at as quickly as you can, but with a nice rate, as much as you can. You can go. Perfect. That's good. Okay, I want you to do the same thing, but with the t sound. So ta 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 ta. Great. Now do the same thing, but with the k sound. So ka 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 ka. Okay, that's good. Now I want you to do the same thing, but with pataka. So we're just combining those sounds. So say pataka, pataka, pataka for 10 seconds.
Pataka, 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 pataka.
Thank you. All right, so I'm going to look inside your mouth again, and this time I'm just going to be looking at your the back of your mouth to make sure that your soft palate rises as you say ah, ah. Okay, so just say ah, ah for me.
Ah, ah.
And you know what? I'm going to use this so I can see a little bit better.
Ah, ah.
Perfect. Now I'm going to test for oral sensitivity. So to do that, I'm just going to put the tongue depressor on the sides of your mouth or the sides of different sides of your tongue. And whatever side I put it on, raise that hand. Great. Now this one isn't as fun, but I'm going to be testing your gag reflex. So I'm just going to slowly move the tongue depressor back until you exhibit a gag reflex, and then I'll take it out. Alright, it's not fun. So I'm going to look more at the function of the larynx now and have you look at your voice quality by having you say ah for about 6 seconds.
Ah.
Great. And so I was able to tell that it was clear and not gurgly or wet. I'm going to assess the pitch by having you just raise up a little bit in the pitch. So can you say ah?
Ah.
Great. Now, can you cough for me? And can you do a throat clear for me? Great, thank you. Okay, so the last part of the oral mech exam is just to have you swallow without any liquids or foods. And I'm going to be putting my hands on your neck. Feeling the different. Okay, can you do a swallow for me? Great, thank you.